Hello my dear students. So today I am going to discuss with you a very important topic, that is levels of prevention. Let's start the topic. So in today's presentation I am going to cover two things with you, that is introduction and second one is different level of prevention. Now introduction. See, what is the goal of public health? The main goal of public health is to improve the health of the individual, to improve the health of the community, to improve the health of the population, right? How you can improve the health of the people? How you can improve the health of the individual? By addressing their risk factors, right? By preventing them from various diseases, by promoting their health. So how you can promote their health? So you can educate them, right? These are the things should be a part of your diet, these are the things should not be a part of your diet, right? And you have to educate them how you can modify your lifestyle, right? This is the way you can improve the health of the individual, the health of the individual in a particular community. Now let's come to the levels of prevention. So there are 4 levels of prevention: primordial prevention, primary prevention, secondary prevention and tertiary prevention. So let's discuss them one by one. First one is primordial prevention. Now what is primordial prevention? Primordial prevention, it basically focuses on the risk factor prevention. How? For example, during your visit in a community, you have observed that like 60% of your population is comprised with adolescent females or adolescent women, right? Now, at that point of time, you have planned strategies in your mind. You have planned a health camps for them, in which you start educating them like why nutrition is important for you, what all should be part of your diet, what do you mean by balanced diet, what comes under balanced diet, why it is important to maintain the personal hygiene, why it is important to maintain the menstrual hygiene, right? So that you can reduce the chances of preterm birth in your area. You have to reduce the chances of maternal death in your area. And sometimes adolescent, they may complain you lot of issues like some nutritional deficiencies. So whatever issues they have, you can sort it out in your camps, right? So this comes under primordial prevention. Next one is primary prevention. Now, what is primary prevention? See, primary prevention means you are addressing the risk factors. So when you are addressing the risk factor, that means you are reducing the chances of that particular disease in your area. For example, during your visit in a community, you have visited one family where you have seen that grandfather is diabetic and hypertensive, grandmother is diabetic and hypertensive, father is also hypertensive and diabetic, right? So at that point of time, you have planned some strategies like this is a genetic disease, so it passes from generation to generation. So immediately you have planned some health educations for the people, for the family for the family members, right? So you have educate them regarding the dietary patterns, you have educate them like how you can modify your lifestyle, right? So you can improve the quality of life, right? For example, another thing is like you have seen that the environment is not good for the family members, or it's very unhygienic. So you have planned to educate them why it is important to focuses on the environmental hygiene. So what are the points should be a part of your environmental hygiene, right? So that comes under your primary prevention. Now, next is secondary prevention. Now, secondary prevention means you want to control the progression of a particular disease. For example, you have visited a family and you have seen that person is there and person is very sick, person is having a fever, person is having a cold, cough, and person is also complains you like I am having a body ache, right? So immediately you can educate the person, or you can accompany the person to nearby sub center, to nearby community community health center or nearby district hospital or PHC, right? You can consult the doctor. So after consultation, you can, educate the person to go for lab investigation, right? Why lab investigation? Because lab investigations are the first step to diagnose a particular disease, right? So on the basis of that, we are able to diagnose a particular disease, and after diagnosis, we are able to prevent a particular disease or community, or we can say that we can start the treatment at immediate point of time, right? So that we can control the progression of that disease, right? That comes under your secondary prevention. Now, next is tertiary prevention. So what is tertiary prevention? Tertiary prevention includes two things. First one is disability limitation, and second one is rehabilitation. See, person is diagnosed, for example, person is diagnosed with particular disease, and immediately you have to start the treatment. Why? So that you can limit the disability in that particular person, right? For example, if person is physically disabled, or we can say that a person is visual disabled, right? So you can educate the person, or you can engage the person in some vocational courses so that he or she can live his or her life independently, right? Or we can say that we want to improve the quality of life of individual, right? So that's why we will engage the person in these vocational courses so that he or she should live their happy life, right? Another thing is, like, support groups are there in the community, so we can educate the person to join these groups so that he or she can ventilate their feelings with their group mates, right? So that comes under tertiary prevention. Thanks for watching my video. So for more learning on community health nursing bites, keep watching my videos and like, share and subscribe my channel. Thank you very much.